morning, everyone. It's an honor to me to be given the opportunity to present this topic. I consider it as an opportunity, also an investment in Nasir. I will start by thanking the organizers for giving me the opportunity. Along the line, we shall see different forms of investment that is needed by the nursing profession. Investment needed to be done by governments, investment needed to be done by the nurses associations, and also investment needed to be done by nurses themselves. So I want to start. My presentation outline includes the government needed and expected investment in nursing. Where are we headed to? And also the role of nursing associations in investing in nursing. Also philanthropies, roles philanthropies can play in investment in nursing. Followed by self-investment, self-empowerment opportunities for nurses and midwives. And I think this is more important to me, especially that these are nurses leaders. The presentation is to be given to nurses leaders, and I think it is important we concentrate on investment opportunities that is for us, so that we can empower ourselves. I would also want to introduce something new that is referred to as verified ideology, as also part of investment. And this is a project we have been doing since 2016 to date. I think the first time we are bringing this to the public, to the limelight, now that it has matured. So I want to start with the first objective, that is the government needed investment. Truly speaking, when we are discussing investment in nursing, everyone will agree with me that the investment done in nursing profession is not adequate across the country, probably even beyond the country. But it's good for us to identify the gaps. Even if we want to negotiate or want to approach any person, we need to identify the gaps before we can start discussing where the needed investment is. There is this popular saying that is mentioned by the International Council of Nursing in 2016, that investment in nursing and high quality patient care are two sides of the same coin. When you have a coin, if you invest in nursing, then you are less assured that the other side of the coin will also work. If you refuse or you can't investment in nursing, you are less assured that there is not going to be quality patient care. So you invested in nursing is equally invested in healthcare and also trying to update the healthcare of the population. This is a research-proven statement. There are several researches in the academia that are showing that, truly speaking, if you want to improve on patients' welfare and quality of care, the only thing or the most important thing that you need to do is to invest in nursing. Then you will have it done. And this statement is also corroborated by the Beijing conference, the 17th International Council of Nursing Asia conference that is done. Also, the Washington DC ICN Forum in 2016. Both the forums, there are different participants in different continents of the world, but their conclusion is that you have to invest in nursing if you want to guarantee quality patient care. Not only the ICN, maybe we may say ICN is ICN because they are nurses, they may be overcentric, no. But the United Nations High-Level Commission on Health, Employment and Economic Growth 2016 is also saying the same thing, that when you have nurses that are satisfied, they are dignified, their rights are respected, then you are rest assured that patients' care is going to be optimal in the hospital. And the reverse is the case when you have a reverse situation. When your nurses are dissatisfied, they are disenchanted, they are overworked, they are underpaid, and so on, then the impact is on the patient's care. The Commission rightly called for a change in the political mindset to recognize that investment in health actually drives rather than drains economic prosperity. Because there is this concern by governments across the globe that when you are investing in healthcare, you don't see the outcomes. Because if this is a social investment, it's not a financial investment that you invest $1 million today and tomorrow you realize maybe $2 million or thereabouts. This is an investment, a social investment that you need to do. But the report, when the slides are going to be shared with you, this is a link that will give you the entire report that will show how investment in nursing really impacts on patients' care. Think about it for a moment. Let's consider these things. For instance, when you have health services, health services keep the population working and productive, support families and communities, invest enormously in educating women and young people, provide a huge market for other economic sectors such as goods and services, and drive research and innovation. But when you cut in healthcare, you say that you cut in health, are also cut in other sectors, creating a major impact on the economy overall health. Like I said, if you have satisfied nurses, well paid, then you are less assured that your hospital is going to be optimal and the patient's care is going to be concerned. The major areas where nurses' rights are in breach are on payments and also overworking them, and sometimes also scholarship. Let's take for some examples, low wages. I think on Monday I saw a report. The Chief Medical Director of Lagos State University Teaching Hospital was complaining that on daily basis, at least 4 or 5 nurses resign from the hospital. And this shows that they are not satisfied. If on daily basis, he's the same day and he's the one saying that every day he has to sign resignation letters from nurses that they are resigning and moving abroad. When you may have friends that are working abroad, some of them are making it, and very many of them are not making it. Because even the payment in UK and other places is not really adequate. You hardly make savings. The changes that we need to do as a government in Nigeria is very little. When you improve the salary to a certain percentage, majority of the people that are moving outside Nigeria will stop moving out, because making savings while you are in Europe is not an easy thing. You get a lot of money, you spend all the money that you get on cost of living. There is high cost of living in Nigeria really, but it's not comparable to what is sustainable in Europe at all. You can make a lot of savings. So low wages is one of the examples, and also inadequate staffing. You get a hospital, and in the hospital, maybe the nurses' strength is not more than 50% of what is required. And this 50% of nurses are doing what 100% nurses need to do in the hospital. Over time, they are overworked, burnout is there, and it affects their health and so on. And so these are instances where nurses' rights are really infringed. There is this article on nursing notes that is saying enough is enough. Fix short staffing, poor pay, and burnout, or we are leaving. This is an article on the nursing notes. It's a UK-based news organization that they are saying the nurses in UK are saying either fix the poor pay and also the understaffing, or we shall leave. And this is very serious. The forums I mentioned about, that is the Asia Forum and also the Washington DC Forum, both of them emphasize that understaffing commonly leads to overworked and burnout nurses, resulting in high sickness and turnover rates, and most significantly increased numbers of untoward patient incidents, including trips, falls, and medication error. And this is the consequences of overworked nurses. Foreign participants recognize that by making the right investment and actions, countries and regions will have healthier people, and healthier people translate to healthier and more sustainable economies. Financial investment is needed to scale up socially accountable education, train appropriate numbers of nurses, create decent working conditions, and stimulate health sector jobs, particularly for women and youth. I think this is very key. Majority of the people out there that are not within the healthcare sector have the impression that nurses and healthcare workers generally are the most paid, and they are well to do. They have enough. But the reality is the reverse. Just take for instance, how many of us here, nurses leaders, heads of institutions across the country that are seated here, how many of us that your savings, maybe by the end of the year, your salary, your savings is enough to take you for a vacation, maybe in Turkey or United States of America, out of your savings without anything? How many nurses leaders will have their savings out of their salary? Maybe only 30% of your salary is used for your housekeeping, but you have 70% for maybe savings for your health care, for hospital, and so on. So no matter how much you are paid, you are still underpaid. So when we look at it from that angle, then we can now negotiate it. But then this is not only the negotiating, the way to negotiate. Even the negotiation needs a lot of skills and needs also a lot of data in order to approve the authorities. All forum participants agree that tackling the complex agenda facing both the profession and healthcare requires nurses being at the heart of policy and decision making. There is this saying that says, if you are not on the table, you are likely to do on the menu. When nurses leaders are not on the table, they are likely to be on the table. If you are on the table, it means you are the one that is being discussed on the table. Isn't it? But like I said, leadership and negotiation skills are highly needed to empower the profession to influence national and regional health and education strategic plans and to lobby the government and others to increase workforce investment. We cannot be dismissed as arguing purely on grounds of professional protectionism. I think one of the ways that we can use to bring to the limelight that there is shortage of nurses in a particular hospital is the whistle. The whistle, that is the workload indicators of staffing need. This is a tool. This is also a skill. And I also want to advocate that maybe if there is any opportunity for nurses leaders to be trained on this tool, we need to be trained so that we can use it to show as a advocacy that this is actually the gap. WISIN is domiciled with the WHO. It's a tool, it's a digital tool. When you apply it, for instance, this is a teaching hospital. If the nurses leaders will apply the tool here, it will give them an opportunity to know what percentage of nurses is actually available and what is the gap. And you can use it. This is an internationally recognized tool that can tell you how many nurses you need in a particular facilities, how many doctors you need, how many pharmacists, and so on. As the case is, the situation now is that employment is just a prerogative of the government. They employ doctors, they employ nurses as they wish, or as they think their budget can afford. But it's not what a budget can afford, rather, but what is actually the need of the population. If truly we understand that it is our own responsibility to give quality health care to our people as government, then we should be able to know that, okay, how many nurses are we supposed to employ per state, per facility, us and the nation, unlike what is sustainable now. We advocate that WISIN training for nurse leaders is done. Like I said, it's domiciled with the WHO. Different countries across the globe, I am sharing with the organizers the 40-page document that as a manual for this WISIN from the WHO, also showing different countries' experience, how they use the whistle and how they were able to know what is their gaps. I am not too sure if the Minister of Health of our country can tell us offhand that I have maybe 50% or 70% of my needed nurses employed in the hospitals, and my gap is 30% or something like that. We are not too sure what is the gap. In a particular hospital, for instance, a teaching hospital like this, we are not too sure what is the gap. We are just there. I can remember one of the chief medical directors and also the director of nursing services, that the director of nursing services in a particular hospital was telling me that the chief medical director was asking me, we employ nurses, but I'm not seeing the nurses in the hospital. I think the person is even seated among us here. And he said he went and brought the distribution of the nurses and showed it to the chief medical director. And he saw where all the nurses are placed. And he saw that there are even gaps. And when we went to him to visit him, he said even if he is given the opportunity to employ 500 nurses, he will not hesitate to employ them. But it's because of the intelligence and also the up and doing of that particular director of nursing services. Otherwise, he may be parabolating or be even fail to explain where are the nurses. But in this situation, when the whistle is applied, you can apply whistles per facility, you can apply it per state, you can apply it per country. When this is applied, it's a tool, it's a digital tool that can tell you, okay, this hospital of this size, of this number of patients that are coming, we need so number of nurses, so number of midwives, so number of medical doctors and so on. So when you use it as an advocacy tool, even when you are making your budget, I think it's more accurate, and also it can convince the employers, okay, we say the nurses that are working in the hospital are only 30%. No policy maker will hear that we only employ 30% of the needed nurses in the hospital, and we can just dismiss you. But when there are no advocacy tools, you only go and advocate for there is a lot of people people are not being attended and so on. They don't understand. So I'm emphasizing that we try to get, I think the association, this one can contact the WHO for the training, and they have the tools and also the training. I even funding. In fact, they even have funding for different countries that they can fund the training, not necessarily nurses funding it themselves. Thank you for listening. The second section of my presentation is what role can philanthropists play in terms of investment in nurses. I brought an example of the Robert Wood Johnson Foundation as an example. It's a spectacular example of investment in nurses. This guy, for more than 50 years now, incidentally we are presenting this thing today, and they are also doing their 50th anniversary of existence in the United States of America. The Johnson & Johnson Foundation, you must have heard about Johnson & Johnson. Robert Wood Johnson was actually a military officer, but while he was a young person, he suffered rheumatism, and often now and then he had been admitted to the hospital. And it was then that he got to understand the role of nursing and the relevance of nursing, and he now endowed all his money, all of his earnings into nursing. And there is so many things in bringing up nursing. So I'm bringing this in order to show how maybe a foundation or maybe a philanthropy can invest in nursing. When you visit this site, you will see so many opportunities that the Johnson & Johnson Foundation are doing. But maybe part of what I can read for our benefit is that General Robert Wood Johnson, who founded the RWJF, recognized the value of empowered, well-educated nurses. As a young man, he was frequently hospitalized for chronic health problems and learned about healthcare firsthand. He wrote the booklet Service to the Patient, in which he championed empowering nurses to make care decisions, among other innovations. The Robert Wood Johnson Foundation, which he devotes his personal appointment, has promoted nurse leadership, education and practice, and nurse-led research ever since. In fact, at one time, it was the foundation that set the ladder and said, we want to have maybe to raise the number of PhDs in nursing, and they gave a lot of scholarship for nurses to get their PhD, so that nurses can have the position and also the authority to speak on behalf of patients. So in Nigeria, I am not aware of a major investment that is done by philanthropists. Maybe maybe a rich person investing in nursing. You can get maybe investment in terms of infrastructure, building boats or building supply chains, but something that is particular to nursing. And even the nurse leaders that have ascended so much and have a lot of ways can equally grow a little from what this guy has done. This person was never a nurse, he was just a young person, and later on he became a brigadier general in the military of the United States of America during the World War II, and he donated all of his earnings in life to the foundation. And Johnson Foundation have done a lot of things across the globe, including the 911. That 911, the emergency line, was actually invented and created by the Johnson Foundation. So the other aspect of my presentation is, okay, as nurses, individual nurses, are there opportunities for us to invest in ourselves? Are there opportunities for us to empower ourselves better than how we are now? And also, are there some technology or some websites and database, some maybe links that can also help us to empower ourselves? This is my third part of the presentation. There are innovative health programs for low and middle income countries that provide empowerment opportunities for nurses and midwives. I'm introducing this thing for us in order to look at how we can key into it and benefit from it. Along the line, I'm going to share some maybe projections of the website that you can see how they are working. One of them is the Center for Health Market Innovation, the CHMI database. This is a wonderful database. I don't know if anyone has come across it, but this is a very wonderful database that no matter what is your specialty, you can get something that is entrepreneurial as far as nurses are concerned. We shall look at it in due course. The site has more than 1,400 innovative health enterprises, non-profits, public-private partnership, and policies that are there for nurses and midwives. On the database, maybe you can see several opportunities. For instance, when we are talking about education, higher education and professional training, employment and income generation, participation and representation in social and professional and also political institutions, promotion of autonomy and enhanced self-esteem and self-efficacy, increased mobility and freedom of movement, access to trading, ownership of properties, assets and businesses, particularly promising programs for harmonizing health service delivery with empowerment. Examples of them include the training programs, either a pre-service training, specialty training, continuous education training, or bridging. There is also an ICT inclined opportunity that we can all key into. For instance, the clinic pack. The clinic pack means clinical patient administration kit. This is a kit that you can download. When you download it, you can register yourself and you become a champion for within your own neighborhood or within your hospital. M-Health is there, E-Health is there, and also e-learning is there. Not only that, we also have the network and cooperatives. We have a lot of networks of nurses and we have a lot of cooperatives, but in what way are they working? When we look at the entrepreneurs, we see a different way of how entrepreneurship are done, and also maybe some franchises. A franchise like Access Apia. Let me use this opportunity and show maybe some of the websites. For instance, Okay, so the technology is existing, but we shall come back to it by the time I finish my presentation. Okay, now the last aspect of our presentation is the new concept e-learning. For those of us that are from the Women for Health states, can remember 2017, 2018, and 2019 projects of the Women for Health on e-learning, and you can remember how cumbersome it is. But over time, technology is moving forward, and I think it is an opportunity to show you a different sort of how e-learning can be done, not only for schools, also for hospitals. In fact, today we have moved forward so much with the Raspberry Pi technology. The Raspberry Pi technology is e-learning made simpler and more effective. A spectacular opportunity for hospitals and training institutions. I want to show you how it is. Can you see this picture? It looks like a keyboard, but that is the whole thing you need for your e-learning today. You can remember, I think I can remember your e-learning room, your solar facilities, the panels, and all the headache. Every day, every new day has its own headache. But this is what we need, the only thing that you need for e-learning in hospital, also in the colleges of nursing. For instance, I think we can take out your phones and try to connect to this now. You will see how you can connect. Use the Wi-Fi. Just open your Wi-Fi, you will see something called a TV box. Then you try to connect to it. You got it? Password. Password, a TV box.
E-box.
A TV, right? Look at it written.
The password.
When you ask the password, just write a TV box, it will take you there.
Right box.
It's written there. Can we have your attention now? Now this is the page. Maybe you can keep up your devices. If you are able to connect, fine. If you are able to connect, maybe we can discuss later. This is the site. Maybe these are sample courses that we put there. The clinical teaching skill. This is for preceptors and clinical instructors. We have being a paramedic, COVID-19 interactive case files, and so on. But what I'm trying to say is, now this is the whole machine. It's everything that you are seeing on your asset and also that is on the side is this one. Nothing less, nothing more. So this is the only thing that you need. For instance, if you are training nurses in the hospital, the preceptor can have this, and all nurses that are working within the hospital circumference can have access to the information here. Now this one can get connected to 30 computers across wards. While you are there, maybe the director of nursing service will have this in his office or in our office, while all the computers that are in the different wards of the hospital, either wired connection or wireless connection, you don't even need a computer, you only need a monitor and a keyboard. In a particular ward, you only need a monitor and a keyboard. And information can be retrieved and also can be printed on this. So it's like you have a cluster computer for the entire hospital. If you are training in your college, for instance, in the library, when you put these things, your students have access to the entire content that you put there. And maybe you can do it departmentally. Maybe one department, midwifery department, public health department, general studies, and so on can have each. It's totally different from the e-learning we have worked on in 2017-2018 in the states that we have worked on e-learning. Because that one is very cumbersome, so expensive, and this is not much. The price of this is a surprise. Guess how much is it? No, it's in dollars. Yeah. The price of this, not $100, yeah, yeah, the whole of it is $300. Equivalent of how much now? Equivalent of 200,000. Yeah, maybe 200,000 or thereabouts. Yeah, so the other expenses may be the content, depending on the type of content that you want to put, but you can even put your content yourself. You don't have to buy content from anywhere. You just buy it and work on it. Now, the capacity is what you put. It can take anything. It can take 1 terabyte. So it's not limited by capacity. It has a memory chip that you can put. For instance, this one has 62 gigabytes memory chip, but you can look at it. You can just put an external hard drive here that is giving up to 1 terabyte. It does not matter, and it can check. Now, this is as a result of my relationship with Atingi. Atingi is GIZ, is a German international corporation. They are the one working on this, and my connection with them is what brought about these things. And this is what we are working on in order to transform nursing education and nursing practice as a whole. Because e-learning has become an indispensable thing that is the future of education, definitely. So this is what we are working on. For the other websites, now I mentioned about now this is the first website I mentioned, first marketing directions. Please take time and visit this website when you receive the presentation. You can see innovations database, analysis of what works, learning and adaptation. There are 1,400 opportunities for nurses and midwives. Maybe a simplest example that we can give is the Doctor Dial. This Doctor Dial is an app. When you subscribe to it as a nurse in your neighborhood, all the residents of the neighborhood knew you as a nurse, and they can key into your site, just like WhatsApp is working, like WhatsApp network. Here you have your network, and when they have any health issue, they contact you through the Doctor Dial. On any health, depending on your specialty, family planning, some diagnostics, some other issues like that. But we are saying this as an opportunity because you will be seated in your office and working for so many people. When you visit the villages, you see so many dirty things because they do not have access to a nurse that can guide you. But if they know about you and they can just use their assets and connect to you, you can have a lot of influence on these people and also give them the right information. And they subscribe to you. They pay premium. Maybe even if it's 100 naira per consultation, depending on your network, it will take you a lot of places. I think it's much better than what we are seeing now. When you visit a hospital, you meet people with nurses uniform, but they are not nurses. And so many calamities are happening as a result of that. Or sometimes you go, for instance, yesterday while I was coming at branch in the hospital at Kaleri, at the A&E, there are more than 50 patients, all of them sick. When you see them, they are really sick. There isn't a single nurse to attend to them. A single nurse was not there. At about 1 p.m., I was in the hospital, but there are more than 50 on queue, waiting for someone to come and attend to them. All of the people that are attending to them, and some of them are even environmental health officers. So, but if we can use this as an opportunity, we can transform the healthcare. We can also showcase our capacity as nurses. I am sure this is a very big innovation for nurses. Okay, this is the other side. The access card here is Swahili works. So similar to the Dr. Dai, but this is a Swahili way of doing things. They do a lot of things. It's called access. It's a franchise, and you can connect to different hospitals. You can refer patients. You can also attend to patients, and you can attend to them at home. If you take it as an enterprise, it takes you to a different place. And the final slide is received product. Okay, I think we have come to the end of the presentation. This is the company that we are working on, the changing box. EX Technologies Nigeria Limited. You can reach the company through this email. And thank you for listening. So I'm still around for the next 30 minutes. If you have questions, then you are